warm welcome to the special show on Banega Swast India. Today we mark World Neglected Tropical Disease Day. But now, what is this day? What is it about? Well, this day is marked as an awareness day for addressing neglected tropical diseases, which are viral, parasitic, and bacterial diseases, which are found in the tropical regions of the world. We all know that these diseases have groped in millions of people around the world, and most of these diseases or conditions are preventable. So I think that is key to know that these are preventable. To answer our questions that how can these be prevented, how are these diseases treated, and what really are the obstacles, where are they coming behind from, we have with us an expert today. We have with us Dr. Neeraj Dhingra. He's a former director at the National Vector-Borne Disease Control Program. He's also a member of the World Health Organization Strategic and Technical Advisory Group on NTDs. Thank you so much, Dr. Dhingra, for joining us today. What really are tropical neglected diseases? What are the kind of conditions that these diseases are listed under? Something very basics. And what has led to this neglect? Which regions have the maximum of NTDs? I know there are a lot of questions together, but I think these are the basics which our viewers would like to know.
Sure. I think, as you have already said it, these neglected tropical diseases, these consist of 20 diseases. There are 20 diseases which are included in this neglected tropical diseases. And they're mostly prevalent in the tropical areas where the climate remains a little bit warm, humid. So those are the areas that are there. And, they affect mostly the most impoverished community and also affect women and children. Besides this, they also cause, in a way, they also cause a lot of morbidity. Socioeconomic consequences also are there of the disease. And these entities sometimes happen to be very complex because in the sense their transmission is linked to many environmental conditions, many of them which are vector-borne, have animal reservoirs, and they have complex life cycles. So all these diseases, all these factors make public health control a challenge for them.
Okay.
When we say neglected, basically what we mean by, normally these diseases were not on the global health agenda. Somehow they were missed. And the investment or the funding that was there was minimal into that. And also were associated with stigma and sort of social exclusion also in these diseases. So what happens is these populations which get affected by these diseases, they have others also, like they may affect the educational outcomes. They also affect their professional capacities.
Yes.
So that's why somewhat they say these were neglected till recently.
Okay.
About your part, how many people or which areas are affected? WHO estimates around 1.7 billion of the world population needs prevention and treatment for at least one of these diseases. Now, besides this, if you look at other technical aspects, they also cause around 200,000 deaths, 2 lakh deaths. And also, what we call as disability adjusted life years, around 19 million life years are lost every year because of that. And if you see, they are mostly affecting the developing countries or so-called the countries which are now progressing. So what this means, they lead to indirect health cost, they lead to loss of productivity, and also in a way reduce socioeconomic and, as I said, educational attainments.
So what are those 4-5 neglected tropical diseases or conditions that are prevalent in India, most common?
Yeah. India, we have number of diseases that I'm going to name them. For example, the common ones are, for example, Kala-Azar, which we call visceral leishmaniasis.
Black fever.
We have black fever, exactly.
Yes.
We have lymphatic filariasis, commonly known as elephantiasis. Then we all know soil-transmitted helminthes, the worm infestation that we have. We also have dengue and chikungunya also. And scabies also there, and snake bite. So these are the common ones. But let me tell you, India has done very well as far as some of the diseases. For example, India is one of the countries which have been eliminated, yaws and guinea worm disease.
Yes.
It also has drastically reduced, that means like leprosy and trachoma, which are no more a concern, no more concerns of disease of public health concern.
So you were telling us, I mean, we spoke about Kala Azar and also about lymphatic filariasis. So tell us about that, because that is a serious problem in India. India, it's prevalent in not only just rural but also urban areas. About 670 million people at risk of contracting lymphatic filariasis in India, which bears about 40% of the global burden of the disease. So, I mean, India does have one of the larger chunks. Could you share with us what are the mitigation strategies?
India is one of the few countries which started what we call as the mass drug administration. If you look at the prevention for lymphatic filariasis, is very simple. We started with one drug that is called the diethylcarbamazine, and then another drug was added that was albendazole. And now we are using a third drug which is called the ivermectin. Fine. If one has to take these drugs once in one year, that means it's one single dose taken 1 year continuously for, depending on which regimen we're using. For two drugs, it's 5 to 6 years. And if you're using ivermectin, diethylcarbamazine, and albendazole, it is 2 to 3 years. So if you use that drug, the parasite, the helminth, they get killed and the transmission is further stopped. The challenge here is this drug has to be consumed by more than 65% of the population, which is targeted for it. Unfortunately, the compliance doesn't reach that level. There's many myths and misconceptions about the drugs that people take. Why should I take a drug if I'm fine? I don't have any disease, but I may be harboring a parasite which may transmit. So I'm not aware of that. So I don't take the drug. So that becomes a problem. India has done quite well. If we start somewhere earlier, there were around 328 districts which are endemic. Now, out of 328, nearly 131 districts already have been eliminated where no MDA or IDA is required. Okay. India is also one of the very few countries which started the third drug. They started with a pilot project of 5 districts and then immediately translating from research into the program within a matter of nearly 6 months, extended to 21 districts. Now 31 districts have been taken into that. So that is a very good thing that India has done.
So if I ask you about some of the programs briefly, which are presently in India, to deal with NTDs, could you share those with us?
Sure. I think we have, for example, for lymphatic filariasis, we have the Accelerated Lymphatic Filariasis Elimination Program in India, which is managed by National Center for Vector-Borne Disease Center. Then we also have the Kala Azar elimination programs are there. We also have soil-transmitted helminths under the Ministry of Health. That is the Ministry of Maternal and Child Health. That is there where we give drugs to them. We also have for dengue and chikungunya, also there is a program under the National Center for Vector-Borne Disease. We are fully aware about the National Leprosy Elimination Program that is there. Rabies also has recently been picked up. That's also there, looking into the vaccination to the dogs as well as to the humans for prevention of spread of rabies. That is there. And definitely, if we look at the India has the best example of eliminating 2 diseases, yaws and guinea worm. So the experience learned from them can be used for elimination of these diseases.
So thank you so much for putting that really, explaining it to us so well. I mean, something which we all know about, but I think clarifying so much. And of course, I think what we've really understood it besides awareness, what we need to do is prevention is key. But even if it happens, how one should deal with it. Thank you so much for sharing all that. And what you said, elimination, but most importantly, sustaining it. Thank you so much for joining us.
Thank you.